Hello, I'm Lonnie Muse, and this is my family health promotion project. So, to start us off, I did my health promotion project on five, a family of five. Kate is the kind of the maternal household figure. All names have been changed to maintain confidentiality. Um, Her family, it was important to establish a family action plan for her son Darren and girlfriend Kim, who are 18 years old and expecting a child. They all live very close together. Kate is a hardworking nurse who actually was pregnant with her oldest daughter when she was 15 years old. Since then, she had two more children, Sarah and Darren. Kate now lives with her oldest significant other or with her significant other and is still raising her youngest 15-year-old daughter, Sarah. The methodologies of data collection were conducted through use of genogram, EcoMap, and multiple interviews. The outcomes of my project changed as I gathered more information. I actually did not know right away that Darren and Kim were pregnant, so I initially was going to do it on, just maintaining a healthier diet, but it became evident that it was more important to focus on preparing this family for the addition of a baby and to establish a plan. So the theoretical framework I used was the family health model. Focuses on how family behaviors affect and impact health. It looks at social networks, environment, community, traditions, and values that surround a patient and their family and relates these factors to how they affect health. Three domains are functional, contextual, and structural. So structural focuses on the routine-orientated stuff, the family diet, the smoking. I didn't look as much into this as I thought I was going to. I looked more into functional, like family roles, interactions, and influences. I also looked a lot into contextual, like genetics, cultural influences, community, extended family, and environment. Family roles, I would say, will be discussed frequently in this presentation. It's not really a traditional family, I would say, because Kate is not married. She's just living with her significant other, Dan, and he's helping raise Sarah. The community and family traditions will also be talked about a lot in this presentation. So I created a family assessment tool based on the table from Denham and page 381 to 383. I felt like this tool was useful because it was well balanced and not just focused on one issue. Um, like I said, I made this before Kim and Darren I found out they were pregnant. So I wish it would have been a little bit more shaped to that. Um, Kate, she worked full time as a nurse and has a 2-year education. Dan, Kate's significant other, he has a high school diploma and he works 40 hours. Darren is Kate's 18-year-old son and has a high school diploma. Kim is Darren's pregnant girlfriend, and she also has a high school diploma. Kate's 15-year-old daughter still lives at home, and she is going to school and is in art and music. The family is very tight-knitted. They have gatherings almost every week, and they are one of those families that, they do a lot together all the time. They're very close. So the genogram and ecomap I created based on comment on the ailments of the family. So a lot of cancer, diabetes, quite a bit of hypertension. Almost every family member had high blood pressure and high cholesterol. So just important to discuss this commonality and manage hypertension to prevent risks associated. Biggest stressors, the new baby, Kate and Dan's jobs, financial hardships, and Kate's extended family issues. In the next slide, we'll talk about how her mother had a stroke as well. So analysis of family story, Kate discussed her concerns. She actually explained it as being triple sandwiched. She's very concerned about raising Sarah and having to help the new baby. Her mother just had a stroke, so she's helping take care of her. Ongoing concerns about financial hardship. She's already working 60 hours a week. She will likely need to support all of these people. Her blood pressure was 150/86 and has not received a cholesterol check or annual in years. Sarah, her daughter, involved in art club and music in school. She works part-time after school. She has a history of depression, so she really needs this time with Kate. Dan, he also has high blood pressure and high cholesterol. He's also concerned about raising Sarah and the new baby. Darren and Kim, they are living together in an apartment. They both actually dropped out of school to work more and prepare for the baby. They're both stressed and nervous about the baby and stated, I don't know if we're going to make it work. We don't know anything about being parents, so hopefully we can make a plan for them and get them feeling better about it. Continued family analysis, so conclusions drawn, they're really great with communication. They're willing to listen to each other, able to voice concerns and feel heard. Assets, Kate and Dan have a house, 2 cars and investments. Darren and Kim have a car. Stressors, financially, of course, the new baby, health concerns, that hypertension. Risks, they're at risk for poverty and effective coping mechanisms. They're just kind of hanging on by a thread, I would say, as far as coping, and at risk for impaired parenting, both of the parents, I would say, and then family burnout because they're stretched so thin. Learning needs, I think it would be urgent to get them into a prenatal nutrition class for Darren and Kim, a birthing class, newborn cares. They have to learn how to take care of a newborn, how to, utilize other community resources other than just Darren and Kim. Goals for the family, I would say increased education, knowledge, help Darren and Kim feel more prepared to lighten the load for Kate and Dan. The nursing diagnosis I chose was risk for impaired parenting as evidenced by insufficient knowledge of parenting, unplanned pregnancy, stressors, obviously a lot of stressors going on, and young parental age, they're both 18. So the Family Action Plan, according to the American Pregnancy Association, there are additional risks associated with teenage pregnancy. With sufficient education preparation, those risks can be prevented, that's my goal. I want to do that for these guys. Darren and Kim both stated they don't know what they want to do. They don't know if they want to breastfeed. They're really concerned because neither of them know anything about newborn cares or nutrition. The genogram and ecomap I used to formulate this family action plan. I used the genogram to identify any genetic conditions that the newborn may be subjected to. I also used the ecomap to identify their resources. They're small community, but they have WIC, and then Planned Parenthood has a website. They have a lot of resources available to them. So my goal is to just make the family feel more prepared for the new child and less stressed out. This outcome will be evidenced by their increased knowledge, by asking them, what have you learned and do you feel more confident in parenting? So the actual family action plan, Darren and Kim will attend 2 pregnancy classes at Ultra Health System. Together we made that plan. I wanted them to bring a pen and paper to both these classes so we could go over them with the whole family so we're all on the same page. The time frame, so they attended the class on November 6th. I met with them shortly after to discuss that list that they made. Renegotiation occurred after we went through the lists to see how things are going, alter plan if needed. Termination, we wrapped up our time, discussed our feelings about the plan, how they were feeling, what will happen after our meetings. Evaluation, we reviewed their list and going through it together, asking them how they're feeling about the pregnancy, comparing it to how they felt before and after, and also asking them, that measurable way to see if goals were achieved, asking them to list ways they will continue to prepare for their child. Since my initial family interview, Darren and Kim took a lot of steps to prepare for parenthood. They attended an infant nutrition class, as I said, and then a birth preparation class. We discussed the list. Kim did decide actually to sign up for WIC, and she's looking into Medicaid as well. Kate also made some changes. She signed up for a gym membership as she's going to be needed in these kids' lives, and downloaded an app on her phone to track her meals and eat healthier. And she did actually go in for her annual checkup. These interventions sparked really useful and great conversations and communication between the whole family. So to reflect, the family health model was helpful in some ways. I felt like learning about Kate's background. She was also pregnant at a very young age, so that was a predictor, for Darren. There were important pieces of knowledge that I may not have gotten out of them without the family health model. However, I was very overwhelmed because there was such a specific life event to discuss. It didn't feel time efficient to discuss some of the questions that I put into my assessment tool. As an interviewer, therapeutic communication, it felt uncomfortable for asking such sensitive questions. With that said, the use of open-ended questions, it did feel like they were more sharing things with me instead of me trying to get things out of them. Barriers, I did know Kim outside of this interview, so I think it's hard to let people know you're struggling, people outside of something like this. Health and literacy, based on the family's level of health literacy, I did feel like the interventions created were appropriate, at Altru. They do make it so I believe it's a 3rd grade level. People are able to understand that. It's for everyone. In retrospect, I would have definitely tailored the family assessment tool more to pregnancy preparedness. I just didn't know that they were pregnant until I sat down until that second meeting, unfortunately. To conclude, the family I chose was a really great family, very forthcoming with their lives. It made this experience really a great learning experience for me. It was incredibly empowering to have a family take my suggestions and interventions so seriously, and I've never had a family put so much effort into my interventions and my suggestions. Using the family health model, it was really helpful to me. I've always just assessed the patient. I've never known how to assess a family or really known what to do, how to go about that. So this project really helped me out with that. So these are my references. I hope you guys enjoyed my presentation. Thank you so much for listening.